So I'm Tracy, and I'm a nurse. I've been a nurse for about 20 years. I've been at the Center for Asbestos-Related Disease for about 8. So most of you probably already know the Libby story, but in 2 slides, here we go. So Libby is extreme northwest Montana. We're that little red dot there. CARD is a nonprofit. We were formed in 2003. We had a vermiculite mine, so it was contaminated with asbestos. And there were community-wide environmental and occupational exposures. That's our building, and we screen for asbestos-related diseases. We manage people with chronic lung disease. We do a lung cancer screening program. We also do research, outreach, education, and advocacy. Our patient population is about 7,000, but about 3,000 of them are diagnosed with a chronic asbestos-related disease. This is very much an approximation, but according to our pulmonologist, we see about 1 lung cancer a month and about 1 mesothelioma a year. Those are referred out, so we don't do any oncology. But the reason I'm here is navigating healthcare and maintaining quality of life. So being sick is scary. Healthcare is extremely complex and confusing. It's intimidating, and this is just a way to say, hey, here's some ideas of a place to start thinking about how you're going to navigate the healthcare system and take care of yourself. So number 1 is always health literacy, being able to access and understand health information and services so that you can make a good decision for yourself or your family member. So ideas, and these never work for everybody, but they're good things to consider for anyone who's going through a tough time with their health. So learn the terms. At least at CARD, we have a big problem with mesothelioma versus lung cancer versus chronic asbestos-related disease versus just exposure. Like I said, we have about 7,000 people. So that means 4,000 of them aren't even diagnosed. They just have exposure. And understanding that, yes, that's a risk, but right now you're not sick, believe it or not, can be tougher than you think. The other thing that's very tough for us is mesothelioma. If you say, oh, you have asbestos-related disease, you wouldn't believe how many people assume automatically that that's mesothelioma. And so understanding what these terms mean is really important. Using credible sources to get information, like Linda was saying, ADAO is really on a campaign to make sure that people have access to good information. Understanding your insurance. So insurance is extremely important. It pays for everything. Knowing where you can go, how you can get there. Taking notes and collecting business cards so that you can ask questions later. Anybody who's been in that sort of traumatic situation where your life has suddenly changed knows that you're gonna later come back and go, oh no, I should have asked this, I should have thought of that. So collect those business cards from everybody you talk to, and most of them are willing to answer questions later. Keep a chronologic record of visits, tests, symptoms, treatments, medications, that sort of thing, because your doctors are gonna ask you about those things and you're not gonna necessarily remember. It's gonna help you make a more informed decision with your family and your doctors later. And of course, the most important thing is you probably can't do all of this alone, so find someone that you trust that can help you do it. After health literacy is communicating with your healthcare providers. So some ideas of better ways to communicate with healthcare providers: schedule early whenever possible. We heard a story earlier about somebody who had to wait, and that is so common. Everything doesn't happen at light speed, even though you're scared to death sometimes. Schedule as early as possible, because the sooner you schedule, the sooner you can get in and get the answers you're looking for. Keep a health history and medication list up to date and on hand. You'll probably see numerous different doctors, and they're all gonna ask for it. Write down your questions in advance so you don't forget them. Again, bring someone with you to your appointments. Anxiety can limit your ability to absorb information. We all know that, but practicing it is a little bit different. There'll be a good sounding board after the fact, and they're also a good fact check. So, did the doctor say this? Do you think it means this? Those sort of conversations are important to have after a doctor's visit. Understand why your doctors choose your tests, medications, and treatments so that you can make decisions about whether you think that's the right choice for you. It's always a great idea to make friends and learn names of your nurses, your doctors, your medical assistants, all of those people, because the more connections you make, the more they're gonna care about you and they're gonna advocate for you as you move forward. So get second and third opinions if you aren't satisfied. That's totally okay to do. And if a ball gets dropped, follow it up. Believe it or not, as a nurse, sometimes we might forget to call in a prescription because there's a lot of other major things going on too. And so saying, hey, don't forget me is important, and don't be afraid to do it. So developing your healthcare team. So building relationships with that whole healthcare team, like I said, can be really helpful. So ideas to consider: pharmacists only deal with medications. They're a great resource. So if you're trying to get that out of your doctor or your nurse and there's 6 other things going on, maybe stop and try asking the pharmacist, because they're the ones that really work with medications only, and they can answer a lot of great questions. Administrative and support staff can help you understand how things work. I know at CARD we have our asbestos health screening program. It's about a 4-hour appointment when you walk in the door. And it can be overwhelming for people if they're afraid they're going to come out of there with a diagnosis of asbestos-related disease. And so our administrative staff really walk them through, this is what you do first. You go get a chest x-ray, you're going to meet with a research associate, we're going to collect an exposure history, and that really helps to reduce anxiety for our patients. Nurses often have more time to talk than doctors do, and so that's a good resource. Primary care often gets overlooked. So maintaining a good relationship with your primary care provider, as well as your oncologist or whoever else your main person is a good idea, because they know you pretty well usually. Patient navigators and case managers are also very helpful. And emotional, social, and spiritual support providers can help you deal with other aspects of your illness. So this part's for caregivers. So managing stress before you get burned out and not trying to do it all are the 2 main points for caregivers. And they're 2 things that we all know, but we also all struggle with, because when you're taking care of someone, you want to do the very best job you can. So these are things to remember. Just take care of yourself too, and that means sleep and exercise and time. Accept your feelings. It's normal to be anxious and feel guilt and feel grief, and it's important to talk to somebody about that. So learn as much as you can about the illness. Just like I was saying, health literacy is important for the patient, also extremely important for the caregiver. It'll help you know what to expect. And trust your instincts about the needs of the person you're caring for and your own needs. And don't try to do it all. It just can't be said enough. There's so many caregivers out there that get so overwhelmed because they are trying to do it all. So setting aside some time to talk with your family, your friends, go over needs with other people. So there are lots of other people out there who can probably help if you just ask. Ask if they're willing to help and see what they could do. And have realistic expectations about what others can do. So maybe they have a full-time job and they can't help every day, but on the weekend they could come over and give you a little respite time. So working through those things with family and friends and others who want to take care of the person that you're the primary caregiver for. All right, the second part of it is maintaining quality of life. So when you're sick, of course, things are going to change. But how do you maintain some kind of a standard of health, happiness, and comfort even though you're sick? So this is separated into a couple of different sections. The first one is physical. Ideas are thinking about pursuing a level of independence that's achievable. We all want to maintain some kind of independence when we're sick, and we also all know that we're going to rely on other people when we're sick to take care of us. So finding something that's important to you to keep, this is my level of independence. Surrounding yourself with a comfortable environment, adapting to weaknesses, fatigue, that sort of things, by use of adaptive equipment. And also addressing physical symptoms. Things like a shower chair are gonna make a big difference in keeping you independent if you need to take your own showers, but you still need a little bit of help, those sorts of things. So don't be afraid to use that physical equipment and ask for other people with ideas, because there are so many people going through illness that also have these challenges. And then refocusing on activities that are compatible with your new normal. And that's a really big one, is understanding what your new normal is and being able to say, okay, what part of physical quality of life do I want to maintain based on who I am now, not who I was a year ago before I was diagnosed. Social quality of life. Poor health can lead to social isolation, which can increase negative feelings and emotions. So strategies to tackle this: try to maintain positive relationships in your life. When you're sick and you're exhausted, it's hard to always keep engaging with everybody. But maintaining just a few very strong positive relationships can be really important to helping you feel fulfilled. So staying engaged again in just a few activities that really matter to you, reaching out to people as you need them. So if you don't go to your clubs and organizations anymore, it's still okay to reach out to people when you're like, wow, I'd really like to talk to somebody and I really miss that socialization. Conserving your activities for energy that's most conserving your energy for activities that's most meaningful to you. So being choosy about what you want to do with your time. And share and be honest about your energy level with people that want to participate in activities with you. So you can't do what you always did, but if you tell people, you know, I'd really love to do that, let's just wait and see if I feel up to it. Or maybe we can change the location. So telling people how you feel makes them feel more involved in that decision making and makes them feel like they're still a part of your life. Take advantage of the asbestos community, of course. And you can do that either in person or through social media. So that's nice to be able to really participate in ADAO and do it from your couch. Financial quality of life. So financial stress from medical expenses can significantly impact your quality of life. This is one that seems overwhelming, and we always recommend that you have somebody help you deal with this. So financial counselors can help you plan and identify resources that are, and they're often free through medical facilities or community organizations. So find some financial counseling if you need it, because that is something that can stress people so much when they're ill, and it's something that really shouldn't. Consider government assistance programs, unemployment, Medicaid, disability, workman's comp, they're all there to help out. Be proactive, asking for hardship variations for bills and debts. And again, these aren't things that you necessarily want to do, but they're things that could help you reduce your stress and anxiety and deal with your illness later. So if you can find a good advocate to help you go through these things, it's well worth it. Consider appointing a financial power of attorney and understand your insurance coverage and course of your illness to help plan your financial future. So emotional quality of life. You're going to experience a whirlwind of emotions, and that's totally normal. Identify healthy emotional outlets. So things that really help you to relax and reflect. Take time for yourself. Identify anything causing you emotional distress that interferes with your ability to cope. That's one of those things that I was talking about financial. A lot of that is like, oh my God, I'm so afraid to go to this doctor who's supposed to be amazing because I don't know if we can afford it. If you identify what that is and have the conversations with people, you'll start to reduce your stress and anxiety, which is going to help your emotional coping abilities. Embrace your spiritual beliefs and don't be afraid to see a counselor or spiritual advisor. So in summary, these are not things that are going to work for everyone, but they're good ideas that are going to help as you go through a lot of stress and anxiety to think about. And so hopefully they've been useful. Thank you.